Hey everybody, my name is Dr. Roger Borbon. I'm a board certified chiropractic neurologist, and we're going to go through today the anti-stress healing applicator, or the ASHA. How to use it, who are the types of people who would benefit from it, and the different kinds of methods or applications that you might be interested in. So first I have Jesse here laying on the mat. He has a t-shirt on, and then the ASHA is underneath him. So in a moment we'll have him come on up so we can see the tissue response going on there. So let's first, while he's laying there, let's cover the concept behind this. So the ASHA is primarily working on letting your body's natural healing process work for you. So one of the big things that we're looking for here is increased circulation, and through the circulation we have your glucose, your collagen fibers, and a lot of your reparative hormones that get delivered to targeted areas for tissue repair. So there's different parameters on time frames that we'll use for this sort of thing, and we'll cover that here in just a moment. Outside of the delivery of fuel to an area, we also want to sweep some things away, whether it's something like neck pain, back pain, migraines, muscle strains, or workout pain or recovery. We have tissue inflammation that goes on. This could be caused from substance P, bradykinin, lactic acid, any metabolic waste that happens at a tissue area. And we want to help to draw that away from that area so we can help repair faster and get back to your next workout quickly. Or if it's a neck pain, back pain, or migraine type of scenario, get to where we can get out of pain, get more into a resting state, and in that resting state or the parasympathetic state, that's where your body repairs and regenerates, so you can actually get over the scenario rather than just putting a band-aid on it like a ibuprofen or something like that. So let's go ahead and have Jesse come on up. And so this is the ASHA right here. So you'll see that there's some points here of contact, and this is through the shirt. Why don't you go ahead and pull your shirt up there. Okay, so we'll see how the camera picks this up, but here in person I can clearly see where he's had the ASHA applied. And you can see the flare response there. You see the flushing of the skin, and you can even feel the temperature difference there. This works a lot like you might use a heat pad or an ice pack, with the big advantage of when you have the heat, if you use it for too long, you can drive too much inflammation or circulation, and that could be damaging. If you have the cold, if you use it for too long, you can also damage nerve endings. And both of those things aren't the most convenient thing either. You have to either have an electrical outlet for a heat pad or a hydroculator, those big tubs of hot water to then apply those hydroculator pads to. The ice packs, you have to have them frozen. This thing is extremely durable and portable, and there's no plugs or creams or water or anything. It's very self-contained, very, very portable and efficient. Great for sticking in your gym bag or your briefcase if you're traveling. Like I have a lot of patients that travel, and when they get to their hotel destination, they'll just put this on their bed and kind of erase their plane flight. So as we look here, there's a couple big things. Here in the office, what we do as far as applications, all of our patients lay on the ASHA for 2 to 5 minutes prior to me seeing them. This helps to get the area warmed up, get it more supple. It makes the treatment smoother. And then we also have the patients take the ASHA home, and in that case we advocate for greater than 12 minutes use. The research has shown that more than 12 minutes use kicks in that parasympathetic nervous system, and again, that's where the resting, repairing, and restorative hormone and neurotransmitter production is stimulated and is delivered to the tissue. So it enhances the relaxation and the reparative side of your physiology. And then, so, as you're looking at this area here, clearly you can see how this area has been affected just from the coloration. This can also be done to the neck. Basically, we just put a little towel rolled up or a pillow to meet the concavity of the neck. Low back, you can do it to the glutes, the hamstrings, the quads, wherever. We have the former world champion decathlete who he has about 5 or 6 of these that he puts on him before he does his weight workouts, and he uses this as part of his warm-up routine. So there's professional athletes who use these, recreational athletes, many doctors such as myself, and then our patients. And our patients love this. And sometimes with our people who are in more acute pain, this is one of those things that we can have them go home with and successfully get out of pain quickly and help them to get some quality sleep. And through that process, that's what helps them to repair and get out of that guarding kind of tension that they have. So that is the synopsis of the ASHA, how to use it, and different applications for its use.